Suddenly it felt like I had been buried alive. I felt like the air was heavy, my body was heavy.
But that's not how COVID-19 started last month for 59-year-old Sandy Rosen.
You know, I would have thought I would have been just the flu version.
The mom of three figured being an active dance teacher and having no underlying health conditions would mean overall she'd be okay. But that wasn't the case.
Something different was happening. My body seemed to be incapable of lifting up from the bed even.
Her doctor and the COVID-19 hotline both asked about her breathing, which she hadn't noted because of all her other symptoms.
I wasn't moving, and there really was no opportunity, I guess, for us to kind of take note of whether or not I was breathing well.
Finally, 9 days after testing positive, she was advised to go to the hospital. And when she got to Surrey Memorial, reality set in.
You have pneumonia and your lungs are failing, and they're just not taking in oxygen.
The condition? Hypoxia, where the body is deprived of oxygen.
The frequency at which we see this occurring with COVID is unlike anything we've seen before.
The next 4 days were touch and go.
All of us who are in the hospital where we don't know which we're going to be.
She was one of the lucky ones. She started to improve with the help of oxygen, returning home last Friday. As she gets better, she has one more piece of advice for people. Buy a pulse oximeter.
Which is just a thing you put on your finger. You can buy it at London Drugs. And immediately we would have known that my lungs were starting to fail.
Doctors agree it's useful to have at home, given how unpredictable this virus has become.
You know, if you do end up calling an 811 or you're calling your medical professional to ask them, it's a very simple number you can give them, and you instantly have that information available to you as to whether you think you should be in hospital.
Whether you have one at home or not, Rosen can't emphasize enough. Don't underestimate COVID-19. Zara Premji, CBC News, Langley.